Hi everybody, this is chapter 34 with disorders affecting motor function. So in this chapter overview, we will be discussing Parkinson's disease, multiple sclerosis, amyotrophic lateral sclerosis, also known as ALS, Huntington disease, and seizure disorders. These are all disorders of the musculoskeletal system. The musculoskeletal system comprises of bones and joints of the skeletal system and the muscles, ligaments, tendons, and cartilage of the muscular system. They work together to support body weight, control movements, and provide stability. Most people take mobility for granted until something restricts their freedom to move. Impaired mobility is a common source of frustration and pain for people with musculoskeletal dysfunction or injury. Just imagine one day you're getting into the shower and all of a sudden you have a hard time raising your leg up over that step that used to not be a big deal. And then the next thing you know, you have grab bars in there just to make it in and out. And you think to yourself, when did this happen and how did this change? That's how quickly some of these things can happen. So conditions that might limit mobility include pain, fatigue, respiratory disorders, cardiovascular disease, nervous system disorders, and musculoskeletal diseases or injury. Some of the more common ones, as you see, are Parkinson's, MS, ALS, Huntington disease, and seizures. What you will often see with someone that has Parkinson's is they'll have some tremors in their arms and hands, and they usually have a very small step shuffling gait. So they're kind of jerky little steps. And they can do therapy, which they call the big program, because what seems like a normal step for you and me for a person with Parkinson's is a very big step, and it takes a lot of time to be able to relearn how to do that. Multiple sclerosis is a chronic inflammatory, demyelinating, and axonal degenerative disorder of the central nervous system. It is generally thought to be an inflammatory autoimmune disease. Disease progression ranges from benign and relatively stable to devastating with rapid deterioration and early death. MS is characterized by lesions that develop at different times and different locations throughout the central nervous system, known as plaques. In MS, demyelination or damage to the myelin sheath causes conduction blocks and dysfunction of the sodium and potassium channels, which are important in neuron depolarization and impulse transmission. There are three types of progression of MS. Relapsing remitting MS, which is where they will remain stable for 10 to 20 years, but can then transition to secondary progressive MS. Secondary progressive MS is gradual worsening with or without occasional relapse, minor remissions, and plateaus. Primary progression MS is progressive deficits from the onset of the disease with occasional plateaus, temporary improvements, or acute relapses. MS is treated with immunomodulatory therapy for the underlying immune disorder and therapies to relieve or limit other symptoms. Amyotrophic lateral sclerosis, or ALS, is a progressive neurodegenerative disease that causes weakness, disability, and death within 3 to 5 years. It is also known as Lou Gehrig's disease after the famous baseball player who died from it. ALS has an insidious onset of slow, progressive, painless weakness in one or more body parts. The diagnosis is based primarily on clinical manifestations. There are 4 stages of ALS, starting with stage 1. Stage 1 is symptom onset or involvement of the first body region. It's where they have recently been diagnosed, and it's mild deficit only in one region, such as speech, an arm, or a leg, and they're usually functionally independent in the upper extremity or activities of daily living and ambulation. The Stage 4B is need for non-invasive ventilation, and the patient is 80% of the way through the disease course. Huntington disease is a progressive, incurable degenerative disease of the brain that causes uncontrolled involuntary movements, dementia, and behavior changes. It is an autosomal dominant inherited disease in which a child of a parent with Huntington disease has a 50% chance of inheriting the gene mutation that causes the disease. The clinical manifestations include involuntary movements, cognitive impairment, and behavioral changes, any or all being present in varying degrees. The most common symptom is known as chorea. It is random and irregular movement that is excessive and spontaneous. As Huntington disease progresses, chorea is replaced with Parkinsonian features of rigidity, bradykinesia, and postural instability. There is no cure for Huntington disease, and there are no medications or therapies that can delay the onset of it, symptoms, or prevent disease progression. Seizure is activity that represents abnormal electrical discharges within the brain that result in involuntary movement and/or behavior and sensory alterations. Febrile seizures occur in children as a result of rapid temperature rise above 102.2 degrees Fahrenheit. It is often associated with an illness. Partial seizures, are also known as focal seizures, occur when abnormal electrical activity is contained within a limited area of the brain. Generalized seizures are caused by abnormal electrical discharge that originates from both hemispheres of the brain. And intractable seizures are those that are refractory, that is, they continue to occur even with optimal medical management. Seizure activity can result in a number of different clinical manifestations depending on the area of the brain in which the abnormal electrical activity occurs. The patterns of generalized seizures occur in certain phases: tonic phase, clonic phase, and postictal phase. The tonic phase is the initial phase and is characterized by muscular rigidity and sudden loss of consciousness. This is usually where you see the person or patient first kind of start to tense up and draw up everything, and you want to turn them onto their side. The clonic phase is where the patient experiences alternating periods of muscular contraction and relaxation in all extremities. And this is when you will see them moving, drawing in, and kind of relaxing where they're going through the seizure. The postictal phase is where the patient's level of consciousness is decreased, and the patient is often sleepy but can be aroused. Usually after they've had their seizure, you'll see their whole body relax, and they'll be very tired and kind of groggy and not really wanting to stay awake. And that's perfectly fine. Status epilepticus is a life-threatening condition characterized by enhanced and sustained electrical activity. Usually, recurrent activity over a period of 30 minutes is sufficient to qualify for status epilepticus. A seizure that continues for more than 5 minutes is unlikely to cease activity without intervention and also meets the standard.